So like I was saying, just run through some kind of like demographics of Bradford, and there's kind of like lots of data hot off the press from the last census, which is kind of like rippling through now. So what we've noticed since the 2000s is there's quite an increase in the diversity in the population and communities in Bradford. And the population itself has seen quite a large growth in the last 10 years. There's well over, or nearly 5.5 million people living in Bradford to date. It still remains the fifth largest local authority outside of London, with the others being Birmingham, Leeds, Sheffield, and Manchester. And as we all know, for those that work or live in Bradford, it's very ethnically diverse, especially from the mid-2000s onwards, and that's not just racially. So we see a lot of kind of like cultural differences, language differences, faith differences, social classes, etc. And what's also interesting, since the last census, and my next slide will go into a little bit more detail about this, it's actually the fourth largest 0 to 16 population in the UK. So, sorry about the business of the slide, but if you look at the first image first, that's the kind of like the population pyramid of and breakdown into the different age groups of the population of Bradford. And there's two particular areas that are really important for today's event. So the pink shaded area is really referring to the childbearing women age of Bradford, and that probably roughly equates to, I just did some crude maths, probably about 37% of the population of the women living in Bradford. And the green shaded area at the bottom shows kind of like probably 7% of the population of Bradford is under 4. So that's proportionately, if we compare it to our cousin cities and towns like Leeds and Huddersfield, Bradford and Sheffield, etc., that's quite large population group. And then for looking at the ethnic breakdown of Bradford, I'm really sorry, but I'm going to have to refer to the screen. So mainly it's white British population, and this is the last census information of 2011. The white British population has reduced somewhat, okay, meaning that other ethnic communities and population groups have increased consequently. So the next largest population group is the South Asian community at over 32%, and they're made up predominantly of Pakistani community, Indian, Bengali, and some Sri Lankans too. And then you have a rise in mixed population groups, so individuals with dual heritage or mixed heritage, that has gone up too. And then the black African community has somewhat reduced since the 2000s, a phenomenon due to Asian flight, where lots of Asian communities came in, and then the black communities tended to move out to neighbouring cities and towns. And then we have the other ethnic groups which fall into mostly into kind of like Arab communities. So we've seen quite a sharp increase. So over the last 15 to 18 years, we've actually seen quite a huge mix of diversity in Bradford. But we also have quite established, small but still significantly, Chinese populations. We've got a really well embedded and established Filipino community, originally migrant workers from the 90s. And then also we have the Kurdish and Afghani communities too from the 1990s. If we look in terms of the religious diversity, this has somewhat changed too since the last census. So predominantly people will identify as Christian, followed by Muslim at nearly 31%, and then the Hindu, Sikh, Buddhist communities making up the smaller proportions. But increasingly what we've also found is that more people over the last 10 years and since 2011 identify as having no religion, Okay, and these are all really important because these are factors which really impact on food choices and selection and overall nutrition of communities that we work with. It's speculated, and I put the word speculated because I was really trying to find some evidence to demonstrate how many different languages are actually spoken in Bradford. I've come across figures like 143, 150, 160, etc. So I'm confident that over 150 spoken languages are present in Bradford, predominantly English, followed by Urdu, and then other kinds of like dialects and spoken languages, but not necessarily written languages, like Patwari, which are associated with the Mirpuri, Pakistani community, Punjabi with the Gujarati and Sikh community. We also have Polish from Central Eastern European, Slovakian, and then also we've got African-speaking languages too, predominantly kind of like Pidgin English, or it might be French, it might be Arabic, etc. And then obviously we have sign language too. However, what was really interesting is that there's been a sharp increase in the rise of individuals in Bradford who actually don't have English as their main language, and that's just over 12%, which is quite significant actually, because it does have an impact on their learning, their access to services and understanding, and overall health literacy, etc. So looking at the economic activity, again, another factor which is really important and has a massive impact on families when they're choosing and purchasing food. So if you look at the activity, economic activity rate of Bradford, just over 51% are economically active, and that refers to anybody who's 16 years or over, but under 65, either in full-time, part-time, or kind of like self-employed position, and contributing to the economy of Bradford. It does exclude full-time students who might have part-time employment. So what that leaves is a large percentage of the population of Bradford who are dependent on the working economy. There's been a rise in the unemployment rate in Bradford since the last census at 3.6%. There has been a decrease in the population of retired people in Bradford. There are more students now than there were in 2011, but actually that could be a reflection of the young population at the same time. They've grown up, they're now still in full-time position, but also the length that you have to stay in full-time education has also increased, hasn't it? There's been an increase in those that actually look after other members of the family, or kind of like stay-at-home individuals. There's also been an increase compared to the national rates of those that are classified as long-term sick or disabled, and 4.5% refers to other, which I wasn't really able to dissect, but I think it's just anybody who... It could include people who weren't identified in the census, okay, but needless to say, there's a large proportion of Bradford that are reliant economically on other individuals. And that does have a massive impact on families. So when we look at the eating habits of young children, there's not a lot of robust data that's been collected or done quite regularly to look at what the eating habits of young children are nationally. But what we do have is a rolling programme, which is the National Diet and Nutrition Survey, last updated in 2020. And if we look at the different age ranges that the survey covers, I've just kind of like picked out some of the kind of like relevant data. So if we looked at the mean sugar intake of sweet and soft drink, intakes was lower actually compared to previous rates. So there were 2 previous surveys that were done, and consumption actually fell by 32% in young children and toddlers, but actually it's still quite high. So even though those figures look like it fell quite a lot comparatively to recommendations, it's still a really high figure. Sugar and chocolate intake are kind of the kind of foods that are popular with young children. There was no change in that. And if we looked at kind of like the average intake of free sugars, according to the different age groups stated there, it was actually double the recommended amount. So basically what that's telling us is that young children actually eat far too much refined carbohydrates, too much sugar from different sources in their diet. And then looking at the micronutrient contents of certain foods and minerals, 9% of young children were actually meeting their vitamin A intakes, but 11% of those that were aged between 4 and 10 years, they had significantly low levels of vitamin A. And that's kind of like really important to know, because the vitamins and mineral content of diets really relates to the quality and nutrient density of young children diets. Vitamin D, so historically Bradford is renowned for having communities which are really at high risk of vitamin D deficiency. And I know I've worked in Bradford for 21 years, and a lot of my work around in public health has been around vitamin D interventions and promoting and reducing and preventing deficiency. So even though rates are currently lower than they were 10 years ago, because we've got a fantastic embedded intervention where we universally supplement all babies from birth to 6 months with Healthy Start vitamins, and also pregnant women get the Healthy Start vitamins during the course of their pregnancy. It's still a high-risk vitamin amongst young children. Calcium intakes were actually above the recommended amounts. There can be lots of reasons for that, actually. In Bradford in particular, something that I'm going to speak about afterwards is there are large amounts of cow's milk that's consumed in young children. So in some ways, there's something positive there. They're meeting their calcium requirements. And things like trans fats, saturated fats, you know, the high intakes of processed foods, ultra-processed foods, convenience foods, takeaway foods, it does mean that there's quite a high percentage of, or more than the recommended level of saturated fat being consumed by young children. So if we look at the maternal dietary habits, again, it's very similar to young children data. Not very much data is around, but the Diet Nutrition Survey of Infants and Young Children, which includes maternal nutrition, is a 10-year rolling programme. It was last done in 2011. And some of the things that I was able to pick out from there shows that mums, particularly those over 35 years old, their diets tended to be healthier than younger mums. Okay, they were more likely to eat breakfast. They included vegetables more often in their diet, and they consumed semi-skimmed or skimmed milk more often than younger mums. They ate less crisps, ate more wholemeal bread, ate more oily fish, and used olive oil more often. And nearly half the older mums took a vitamin supplement during breastfeeding. Okay, and that's probably due to a lot of different reasons. But I had to include that bit at the bottom, okay? Maybe it's just kind of like the impact of being an older mum. They did eat cake significantly more than younger mums. Okay, very telling probably. Okay, so what's the local perspective? What do we see in practice? So as a dietitian, we have a large paediatric service. We also have other teams, other dietetic teams that specialise in nutrition for young children. What we see in practice, so presenting in clinics, in outpatients, there's a high intake of refined sugars. So children are still eating too much sugar through drinks, so soft drinks or juices. Even those marketed at children, unfortunately, have a really high refined carbohydrate content. Confectionery, there's lots of kind of like standard confectionery which aimed at children, but unfortunately some of the baby foods, which are not necessarily contain added sugar, they're actually developed to resemble comparatively, confectionery products. So that's another source. Things like biscuits and sugary breakfast cereals. Yeah, so these are the main sources of refined carbohydrates in young children that we see in Bradford in particular. I mentioned excess cow's milk consumption. So whether there's a misconception or misinformation about milk being the panacea for kind of like good nutrition during early childhood, and kind of like the inability sometimes of families to kind of like reduce the amount of milk whilst the child is being weaned or has been weaned, there's still quite a lot of cow's milk drunk, and we do see lots of children presenting in clinics, for fussy eating behaviour, excess cow's milk, and it is associated with a higher risk of iron deficiency during toddlerhood, because obviously cow's milk is not a good source of iron, but there's a lot of milk that's consumed. We see lots of fussy eating, grazing behaviour in children. So no set meal pattern for young children. So I'm really focusing on children under 4 or 5 years old. This is really, fussy eating behaviour really kind of like presents itself around toddlerhood from about 18 months onwards. And so we see lots of these kind of like snacking, kind of like grazing behaviour, lots of different kind of foods eaten, which isn't ultimately a qualitative diet. It's not very nutrient dense, but it does provide enough calories for that child to sustain. But unfortunately, if you look at the growth charts, it resembles kind of like undergrowth, faltering growth sometimes. But these children seem to get enough calories from their grazing behaviour and the foods that they eat that they maintain those centiles for height. So they grow, but they don't actually put the weight on, unfortunately. So things like irregular meal patterns. So there's quite a lot of missed meals, particularly breakfast time sometimes, or inappropriate foods being used for breakfast. I'm sure you all have come across families, even yourself, you might have done it if you're short of time or there's some other factor impacting your intake. Missed meals, and it's really, really important to ensure that young children do have that regular meal pattern, because they're designed to eat regularly and to have certain foods. So nationally, we also still see low fruit, vegetable and fibre intake in young children. So 2002, 2003 onwards, 3-year campaign, £2 billion spent on 5 a day. Brilliant, everybody knows it. But are we meeting that 5 a day message? Probably not. And in Bradford, it's no different. It's less than 2 portions, if that, per young children a day. And that's consistent. So not very many, or not a significant percentage is meeting the 5 a day message. And there's lots of clinics, am I right, Kerry, in Bradford, where health visitors, public health nurses, staff nurses, etc. There's constipation clinics in Bradford for young children who suffer constipation. Yeah. Poor weaning practices. Okay, so historically this is quite commonly associated with Bradford, especially when you've got lots of social and health inequalities and factors which impact weaning. Either it's early weaning from about 3 to 6 weeks onwards, or it might be late weaning, where weaning doesn't actually start till about 8-9 months in some communities, or it might be inappropriate weaning. So, for example, it depends on the choices of foods that are being offered as first weaning foods or continued through the different stages of weaning. Poor oral health. I think the current figures for children with some kind of oral health issue or dental decay stands at just under 33%, I think, which is much, much higher than the national average. And then it's also a reliance on ultra-processed baby food. So I think nearly 40% of baby food manufactured and sold by retailers is actually classified as ultra-processed. It's not even processed. There's 7 different levels to the different processing of foods, and the ultra-processed foods are right at the bottom. And unfortunately, infant formula does also fall into ultra-processed food too. So there is a real kind of like big reliance on baby food that's manufactured and sold in supermarkets. Foods high in fat and sugar, saturated fat. So we see this, don't we? And there's lots of initiatives, lots of targeted work being done in certain communities to try and reduce the amount of foods that are rich in fat, high in sugar being consumed. So lots of young children relying on takeaway foods, fast foods, convenience foods, or ready-made processed foods, unfortunately. Another factor that we see is food insecurity, and this is really, really kind of like a hot topic at the moment, isn't it? And food poverty. Nearly 40% of children in Bradford live in poverty, and they are impacted by food poverty and food insecurity, unfortunately. And it's all around access, affordability, availability of food. And this is actually much, much greater in certain specific communities, particularly new communities in Bradford. And we do see that. In terms of mineral and vitamin deficiency, we still do get the odd referrals to our outpatient departments. Although we don't have the same levels or the same incidence and prevalence of rickets like we did probably about 10 years ago, we do still see some cases of vitamin D deficiency. They are still picked up by paediatric departments. But also, because of the nature of Bradford and the kind of like social and health inequalities, the urbanised areas, and also food poverty and food insecurity issues, there's lots of children. I mean, it's speculated probably up to 40% of inner city children are iron deficient at some point, especially in early childhood. And obviously, overweight and obesity, that's never really going to leave us. What is interesting is that the rates for 4 to 5-year-olds, or reception years children, has kind of like seen no change in the last 18 months. So that's stabilised somewhat in Bradford. But if we look at all the figures collectively, it has increased again. Over a fifth of young children under 5 are either overweight and obese in Bradford. And that doesn't seem to be changing. And what we're also seeing is, on the other side of that, there's quite a lot of children significantly who are actually impacted by faltering growth, so underweight, not getting enough to eat. And I've mentioned some of the factors that might impact that. So that's the local perspective. That's what we see. In order to promote good nutrition and good initiatives and kind of like promote that general healthy eating message, we need to also understand some of the factors that impact families when they're choosing food. So things like budget. I'm not going to go through this slide in detail because you'll have a copy of it, but things like budget and finance, obviously that's a really big issue, considering the cost of living issue at the moment, nationally and not just in Bradford. We've seen quite a large increase in families actually using food banks and free meal services for food and things, because they just can't afford to feed their families. Things like knowledge and skills. So lack of skills, don't know how to cook food, don't know how to prepare food, etc. Things like access and availability, a big factor which impacts specific communities in particular. There's issues around food deserts, proximity of supermarkets to try and actually get fruits and vegetables, etc. Things like religion, culture, storage, dexterity, health, age, socioeconomic class. We know that the higher the degree of social deprivation, there's going to be less quality in the diet, unfortunately. things like food poverty, which go hand in hand with budget and finance, transport, cooking facilities, and gatekeepers. We're talking about young children, and they're heavily reliant, aren't they, on gatekeepers and carers, parents, the person in charge of menu planning, buying the food, preparing it and serving the food. And also, for young children, they're at an age, especially between the ages of 3 and 5, where they are actually starting to establish likes and dislikes and some habits around food. But if you have kind of like specific likes and preferences, etc., that can also impact the family diet too. So, eating well for the early years. There's some considerations that need to be taken into account when devising good nutrition for young children. So what we have to remember also is that children from birth up to 5 years, there's various development stages. There's lots of different ages and stages. We've got windows of opportunity between weaning age, between 12 months, and then obviously there's periods of rapid growth and through the school years. They also need an energy-dense diet. Okay, they need a highly qualitative, high nutrient quality diet because of their growth and their requirements. And they also have a small stomach capacity. I think often we forget that we have to offer appropriate portion sizes or have realistic expectations. They're not little adults, they are young children, and they have specific needs. So because of that, portion sizes and expectations need to be realistic. They have a variable appetite. Okay, so it will all depend on growth and their needs. They're really good, actually, children, at regulating their own appetite, but unfortunately, adults can override that and have unrealistic expectations of what they should be eating. So because of this, because they're really good at regulating their own appetite, they do have a variable intake, and you'll know that sometimes they eat voraciously, and other times for 2 or 3 days they'll pick at their food. And normally what you'll find is that the changes occur before rapid growth or when growth has occurred. They're still dependent on adults and their gatekeepers for food, so it's really, really important that a family approach is taken. And not just specifically, promoting good nutrition for young children. If the whole family is involved, then that message is more likely to be embedded. They also mimic eating behaviour, don't they? So they look to family members, the gatekeepers, the parents. They learn from their peers through role modelling and also through influences. And there's lots of studies done, lots of evidence out there which demonstrate children liking or having a preference for new foods if somebody before them has liked it or disliked it, etc. They're also learning about food. It's really, really important to kind of like expose them very, very early on through play, preschool, in the home environment, through the choices that they're making, and also getting them involved in environmental issues and topics quite early on, which are age appropriate. You may have come across this, so there's also an association at certain times during toddlerhood between food and emotion for young children. So they do go through this phase around about 18 months where it's called neophobia, so anything that's new to them, it's around sudden self-awareness around that age. And previously, parents might have reported that previously a child might have really enjoyed eating lots of fruits and vegetables or a particular type of food, but unfortunately when they enter this phase, they suddenly don't want to eat that food because it might resemble something that actually is a threat to life or something, and it's argued that it might be a throwback to primeval times, etc. But it's a phase that they go through, and it's normal, and you just have to be persistent in providing that consistent, healthy eating for them. They're also having lots of wider social experiences around food, whether it's kind of like getting involved at home with menu planning, cooking, dining out, establishing routines, etc. And they're also developing relationship with foods through treats and rewards, and also developing certain preferences. And finally, it's also important to take into account that during this age, they also have additional nutritional needs. So we've talked about some of the vitamins. They might have an illness or a medical reason to have additional nutrition needs, or be on a special or restrictive diet. So I'm going to ask you to do a little activity now. In your pack, you should have a worksheet which resembles the one on the screen. So we haven't got long to do this activity. So what I'd like you to do is find that worksheet and follow the instructions by dividing the circle into the sections that represent the 5 food groups, naming the 5 food groups accurately, and then writing some examples of foods in each food group, but you have to include some diverse food groups as well. How did you find that activity? It was just a quick, simple activity to try and get your cogs working. Right, okay, so before I go on to the next slide and kind of like dissect the Eat Well guide for your benefit, what I'd like to do is ask for some volunteers from the audience to share their findings. So, was everybody able to divide the circle or the plate into 5 appropriately sized food groups? Is everyone familiar with the Eat Well guide? I am assuming that most of you will be familiar with it, but I will. Excellent. Okay, lots of nods. Okay. So what are the 5 food groups? Sorry? Okay, so somebody said protein. Okay, anything else? Is protein, okay, so is protein the appropriate name for the food group, or is it the nutrient that we're asking? There you go. Yeah, okay, yeah, so so we've got the beans, pulses, meat and alternatives, so that's one group. Sorry, anybody else? So what? Well done. Okay. Right. Okay, we need 4 more food groups. Carbohydrates, okay. So again, that's a nutrient. So it's the bread, rice, potatoes, and other starchy food groups. Okay, so that's 2. What are the other 3? We've got somebody at the back. You'll have to shout. Excellent. Okay, so fruits and vegetables, that's 3. We need 2 more. Yeah, okay. Dairy and alternatives, fantastic. And then we've got fats and oils. Yeah, fantastic. Well done. Oh, we probably didn't need the mic after it, but thank you so much. Yeah, brilliant. That's a really good effort. Okay, so for extra brownie points, can we think of any? So let's start with the fruits and vegetables food group, okay? We would be here all day if I asked you to name all the fruits and vegetables. I'm not going to ask you to do that. So what are the 6 different ways you can have fruits and vegetables, or young children can include fruits and vegetables in their diet? Yeah, so raw. Yeah, cooked. Okay. Juice. Dried. Okay, I'm getting lots of calls around smoothies, so that would be like raw. Okay, so there's 2 of those. Frozen, fantastic. One of really good sources actually for vitamins and minerals. Frozen fruits and vegetables, really good. And then lastly we have tin. Fantastic, excellent. In fruit juices naturally. Excellent, well done. What about the other groups then? So we've got the bread, rice, potatoes food group. What kind of examples can you add to this group? Okay, that's really interesting. We'll come back to that. Okay, whole grain cereal products you're referring to. Okay. Let's think of it from a young child's perspective and see and wonder whether or not whole grain or high fibre varieties would be suitable for young children. And we're thinking of it from a Bradford perspective too, given our nutritional issues we come across. Okay, any other can anybody name any diverse foods from different communities that fall into the carbohydrate food groups? Okay, we've got chapatis, yes. Okay, so South Asian communities. Okay, pizza, yeah. Naan, okay. Couscous, fantastic. So we're think about your Arab community, think about your African communities, and your Black African Caribbean. Chow mein is more of a composite meal, food, so there's lots of different components there. Biryani, okay, again, is a composite meal. It's made up of lots of different things. So I'll come on to that bit a little bit. What about you, things like your meats? What kind of foods would you expect to fall into this food group? Yeah. So your animal protein, you've got your beans, pulses, eggs, nuts, etc. But think of it from a different communities' perspective too. Any guesses? Lentils, okay. Dals, yeah. Tofu, fantastic, yeah. Yeah. Okay. Thank you so much for contributing. It got you thinking, didn't it? Okay, so let's move on. So are you all familiar with the Eat Well guide? Yeah? Okay. So the Eat Well guide is a model of good eating that is designed for the UK population from about 5 years upwards. It's mainly aimed at kind of like older children and young adults, but we can still use some of the principles from the Eat Well guide and apply them to good nutrition and good eating habits in young children. So you can see, did your diagram look like that? Yeah, fantastic. Okay, that's really good. Excellent. So you've got the 5 food groups. You've got the fruits and veg. You've got potatoes, bread, rice. You've got beans, pulses. You've got the dairy and alternatives, and the fats and oils. So from a younger child's perspective, we're going to use the Eat Well guide, and we're going to go through some of the key messages that need to be promoted. So let's start with the fruits and vegetables. Okay, so again, it's the same principles as adults. We offer 5 portions or servings per day and aim for palm-sized portions. Okay, so adult portions normally, again, we measure by the palm size or 80 grams a day or 3 tablespoons of cooked fruits and vegetables. But when it comes to young children, the easiest way to determine what a portion is for a young child is a palm size. And that's going to vary. So the size of that portion is actually going to vary depending on the age of that child. So from about 1 year, portion size for fruits and vegetables is actually going to be a lot smaller compared to a child who's about 4 or 5, but it's still a portion, okay? And sometimes what we find is in families, there's an expectation that they're not having enough fruit and veg, but actually sometimes if an 18-month-old child actually eats a full banana, that could be 3 portions of fruit there for them, okay? So it's got to be palm appropriate and age appropriate. So go for 5 servings a day. It's really important to try and include and offer a rainbow of different colours every single day. Try to aim for about 5 different colours every day to try and kind of like enhance the amount of different nutrients that are being offered. So every different colour will normally provide a different kind of nutrient for a young child. So that's why it's so crucial, not only that you offer 5 portions a day, but you also offer that variety in the colours too. It's Important to serve fruits and vegetables at each meals and as snacks to try and meet that portion quota, and offer a mixture of sweet and bitter vegetables. It's really, really important to try and introduce bitter tasting vegetables really early on, because what tends to happen is that if too many sweet fruits and vegetables are offered initially, there is an increased preference for sweeter fruits and vegetables, and those bitter tasting things like vegetables like your broccoli or your sprouts or your kale or spinach, etc., might not be taken too. You've got to offer it many times, fruits and vegetables, okay? There's lots of different figures that you can come across. It's got to be offered 10 times, 12 times, 15 times, 22 times. What it really means is that you just got to keep offering them until they're accepted, and they will be accepted. Unless it's my son, who took 14 years to willingly eat cherry tomatoes. I'm still working on the kiwi fruit, but it does work. It does work, okay? And why fruits and vegetables are really important, we've got somebody who wants to join me up here. That's brilliant. Hello. Because there are good sources of fibre, really good sources of vitamin A, C, and E, and folic acid and iron. So let's move on to the potatoes, bread, rice, pasta, and other starchy foods. So it's really, really important. Oh, crikey. Right, okay. It's really important to serve carbohydrate-based foods at each meal. And these are really good because it helps establish a regular meal pattern. So for those children who are missing meals or have got that grazing kind of behaviour, establish breakfast, lunch, and dinner with carbohydrate snacks being offered once or twice a day in between. Choose low fibre varieties where possible. Okay, high fibre varieties are not really appropriate for young children because they bulk up the diet and then become quite low calorie. So it's really important to initially offer low fibre varieties. From about 2 years onwards, you can start introducing some amounts of fibre, but actually, given the population on Bradfords and the needs, it might be better to actually just stick with lower fibre varieties for a little longer. It should make up a third of a young person's diet. They're really good sources of energy, B vitamins in particular, iron if it's a fortified breakfast cereal, and calcium from white flour cereal products. So then we have the beans, pulses, fish and eggs, and meat and other protein. So offer at least 2 portions from this food group. If you're vegetarian, then it should be 3, and if it's a vegan child, then up to 4 portions of protein is required daily. Always serve vitamin C-rich foods at the same meal. Offer lean or unprocessed versions where possible, and include oily fish once a week. And there are good sources of protein, iron, zinc, vitamin D, particularly those that are fortified, vitamin B12 and omega-3 from your oily fish and nuts and seeds. And then we have the dairy and alternatives. So offer 3 servings daily. Serve full-fat versions where appropriate. Okay, from 2 years you can start introducing lower fat varieties like semi-skim milk, but again, because of the needs of the Bradford population, it might be better just to kind of like stick with full fat versions till about 4 or 5 years. If a substitute milk is required, always use either a soya or oats-based milk, which has been fortified, because all the other milks are not as comparable and not nutrient dense or quality enough. They're good sources of protein, calcium, iodine, vitamin B2, vitamin B12. Now, I did mention overconsumption of cow's milk because there's a misconception that a pint of milk or the equivalent is still needed in a toddler's diet. But really what you're looking at from weaning, from about 1 year old, you want to reduce the amount of milk that's being offered, even as a drink, because cheese, milk, yogurt, in those quantities actually provides the equivalent of a pint of milk's worth of calcium. And then oils and spreads. So allow some each day. Use full fat products because obviously young children need an energy dense diet, and oils and fat spreads are a really good source of calories. opt for monounsaturated fat spreads. So those that are made from olive oil, rapeseed, which is typically sold as vegetable oil, walnut oil and avocado oil. Them two are really expensive, so stick with rapeseed or vegetable oil. And fat spreads, things like utterly butterly or buttoli, can't believe it's not butter, they are monounsaturated fat spreads, and they're the most, they're kind of like the first line fat spreads that we would advise. They're good sources of energy, vitamin A, E, omega-3 and 6 fats, but limit foods that that contain too much of these. So your processed foods, your convenience foods, your fast food takeaways. Look at healthier methods of cooking wherever possible, i.e. steaming, boiling, baking, grilling, etc. And then I also wanted to include the South Asian Eat Well Guide in comparison. Okay, so if you're working with a South Asian community, again, you can look through the Eat Well Guide, which is appropriate for South Asian communities, and you have lots of different ideas. And likewise, again, there's an Eat Well Guide, which is similar to the for African and Caribbean communities. And again, it works along the same principles. Where possible, use family foods, encourage those, because every community has an Eat Well Guide equivalent. Okay, so the key messages. I think this is my last slide, Chloe. Okay, so what do we have to remember? Establishing a regular meal pattern with appropriate snacks early. So breakfast, lunch, dinner, and 2 to 3 snacks. Promote 5 a day, so appropriate portion sizing and remembering the rainbow. Include family foods from 1-year-old. So I've put family in inverted commas because they've got to, when I say family, so it's family foods from that community, build the confidence, capability in those family members to be able to use their own family foods and not adopt what they think are superior practices from Western communities. Use family staples and encourage as much as diverse foods as possible. Encourage appropriate portion sizes, so set realistic expectations. They're not little adults, they're children, so, measure your portion sizes and give them appropriate ones. Use healthier methods of cooking. Promote a varied diet using the Eat Well Guide as a model where appropriate. And build positive relationships with food around meal planning, preparation. Get kids involved really early on. They are capable. And wider social and dining experiences, and get them involved with sustainability issues. And my last slide is for anybody who wants any more further information, signpost you to those websites. Thank you so much for listening.